We reduced gum inflammation, yellow stains, and plaque of this 68-year-old from this to this by following this natural and easy 3-step routine for just 3 weeks. Welcome back to the Senior Health Podcast, where East meets wisdom from Japan's oldest doctor. In this episode, we're exploring one of the most overlooked and misunderstood threats to senior health: oral inflammation. So sitting across from me is someone who's over 100 years old, still treating patients every week, and has spent a century watching what really protects the mouth and what slowly destroys it. And he's here today not just to talk about plaque or stains, but to reframe how we think about oral health and aging itself. Doctor, welcome back.
Thank you, John. It's always an honor. So let me ask you this. How can we say it's just normal aging when nearly 70% of adults over 65 have gum disease, and most don't even know it's linked to heart problems, memory loss, and even early death?
For me, that lands hard. And I know that hits home for so many listeners. Far too many. And I'd love to hear from those listening if you've ever struggled with this quietly. Bleeding gums, yellowing teeth, or that fuzzy film you just can't brush away.
Yes, and it's far more common than people realize. I've seen seniors who brush daily, floss perfectly, and still develop gum disease, cavities, and inflammation. That's because this is not just a mouth problem, it's a whole body signal tied to diet, circulation, and even mental health. Today we'll walk through the root causes of a plaque buildup, gum recession, and tooth stains after 60. And I'll show you 3 natural habits that are still practiced in Japanese clinics today. No chemicals, no harsh bleaching, just biology and rhythm. If you stay with us, you'll learn how to protect your mouth, your memory, and your independence.
So the symptoms might be real, but if we miss the cause, we misread the solution.
Exactly, and that's why we're having this conversation. We'll walk through the 3 silent causes of oral breakdown and how simple habits can help you restore strength from the inside out. This isn't cosmetic, it's cellular, and it can begin tonight.
That makes so much sense. And it reminds me of my father-in-law, actually. He was meticulous about brushing, never missed a dentist appointment, but still developed gingivitis in his early 70s. At first, we blamed his toothbrush, then his toothpaste. But no one asked what was going on in his body.
That's the mistake most people make. They treat symptoms on the surface while the root keeps growing underneath.
So let's get into it. Why do so many seniors develop plaque, stains, and gum disease, even when they do everything right?
The real issue, John, is that aging mouths aren't just losing enamel. They're losing blood flow, enzyme activity, and immune resilience. When circulation slows down, the tissues that protect your teeth can't regenerate the way they used to. Saliva production drops, and that saliva is your first line of defense. It cleans, buffers acids, and delivers nutrients to the gums. Without it, even healthy brushing routines fall short.
That's fascinating, because we rarely hear saliva described that way. It's almost treated like a nuisance, not a critical system.
And yet, it's one of the most vital fluids in the entire body. In Japan, we often call it the forgotten immune organ. It's full of antimicrobial peptides, digestive enzymes, and buffering minerals. So when someone's mouth is dry, whether from medications, dehydration, or age, it's not just uncomfortable, it's dangerous.
So you're saying even a small shift in the mouth's internal chemistry can snowball?
Absolutely. A small imbalance, left unaddressed, can create an environment where bacteria thrive and tissues weaken. That's how we see plaque harden into tartar or minor inflammation turn into chronic gingivitis.
That really reframes the whole issue, because if seniors think it's just about brushing harder, they're actually worsening the problem. What they need is support, not scrubbing. I've seen patients go from minty fresh smiles to tooth loss in just a few years, not because they were lazy, but because no one told them what was really happening. And that brings us to the heart of today's discussion. If some habits, even healthy ones, are accelerating oral damage, we need to name them. So let's start there. What are the first 3 mistakes seniors make that quietly destroy oral health, even when they mean well?
The first mistake is using harsh, alcohol-based mouthwashes, especially right after brushing. These products often kill the very bacteria that support oral balance. In Japan, we see the mouth as a microbiome, not a battlefield. When seniors rinse aggressively, they strip away not just bad bacteria, but the good ones that protect their gums and help regulate pH.
That's a concept that's still unfamiliar to many, that not all bacteria are enemies.
Exactly. In fact, some bacteria produce nitric oxide, which supports blood flow and reduces inflammation throughout the body. When we wipe them out, we don't just dry the mouth, we starve the gums.
So this daily freshening up might actually be weakening the entire oral defense system.
Yes, and it's usually paired with another problem, brushing too hard. Seniors often assume that more pressure equals better cleaning. But enamel is not like stone. It's alive and it thins with age. Excessive brushing, especially with hard-bristled brushes, leads to erosion, sensitivity, and even gum recession. The irony is that people think they're doing the right thing. They want to stay clean, stay polished, but they're grinding away the very structures that protect them. Over time, this leads to exposed roots, bleeding gums, and teeth that loosen without warning.
It's heartbreaking, and it's so preventable if people just had better guidance.
The third mistake is a dry mouth from medications and not addressing it. Over 400 common drugs reduce saliva production, from blood pressure meds to antihistamines. But most patients are never warned about the oral consequences.
So, between chemical rinses, hard brushing, and medication side effects, we're looking at a silent breakdown, one that most seniors never connect to their habits. I'm thinking about a patient of mine who used minty mouthwash 3 times a day, brushed after every meal, and still lost 2 molars by 68. He wasn't lazy, he was following advice. And yet, everything he was told to do made things worse. Which leads me to ask, if those are the common pitfalls, what do the healthy routines actually look like, especially in Japan? What are the 3 or 4 natural approaches that truly restore oral strength after 60?
In Japan, one of the most trusted oral health rituals is oil pulling, specifically with warm sesame or coconut oil. It's been used for centuries, not as a replacement for brushing, but as a supplement that helps draw out toxins and reduce inflammation. Seniors with bleeding gums or persistent bad breath often show improvement in just 2 weeks. The key is to swish gently, never forcefully, for 5 to 10 minutes before brushing. This stimulates saliva flow, balances the microbiome, and loosens buildup that toothbrushes can't reach.
That's incredible, and I've had patients say their breath improved overnight. But it's rarely mentioned in Western dental care unless someone's reading wellness blogs.
Yes, and yet studies from the National Institute of Dental and Craniofacial Research show oil pulling can reduce Streptococcus mutans, one of the primary bacteria responsible for plaque and decay. It's not magic, it's mechanical and microbial. You're simply helping the mouth restore its own equilibrium.
So it's less about killing bacteria and more about clearing the environment so the good bacteria can thrive.
Exactly. And that principle carries over into the second remedy, turmeric paste. This is something I've personally used and recommended for decades. Turmeric contains curcumin, a compound that calms inflammation, fights bacteria, and even reduces surface stains over time. Mixed with a bit of salt and coconut oil, it becomes a gentle polish that supports gum tissue while slowly brightening the teeth.
Is this something you've seen work clinically, not just culturally?
Very much so, especially in patients who cannot tolerate commercial whitening products. With consistent use, the turmeric blend soothes the gums and gently restores color, without eroding enamel or disrupting the oral barrier.
That's important because we often assume whitening must come with stinging or peeling, but here you're describing repair, not abrasion.
Exactly, and for those who want even deeper tissue support, especially seniors with sore, red or receding gums, I always suggest aloe vera, not in sugary drinks or flavored gels, but the raw inner pulp of the plant. When applied to the gums, it has a natural cooling effect, reduces swelling, and accelerates the healing of micro tears caused by brushing or dentures.
That's a whole different approach, using food as medicine, not just nutrition.
Yes, and the beauty is how accessible it is. Aloe grows in many homes. It requires no prescription, and unlike synthetic gels, the plant supports not just the mouth surface but its underlying connective tissues.
It's so refreshing to hear this emphasis on restoration rather than sterilization. Seniors are often given antiseptics, bleaching agents, or scraping tools, but nothing that actually nourishes the gums. And what's becoming clear in this conversation is that oral health after 60 is less about what you attack and more about what you protect.
That's right. And that protection isn't only about what we apply, it's also about what we consume. The mouth is the gateway to the body. So if our food is irritating, acidic, or nutrient poor, no amount of brushing can undo that damage.
So it's time we talk about the next piece of the puzzle, the role of diet. Because if certain foods are quietly wearing down our teeth or gums each morning, we need to understand what those are and what to eat instead.
One of the most overlooked factors in oral health is what we eat first thing in the morning and how we combine those foods. Many seniors begin their day with toast and orange juice or fruit and coffee, thinking they're starting off clean and light, but those combinations create a surge of acid that weakens enamel before the mouth has a chance to protect itself. The timing, the pH, and the food pairings all matter more than people realize.
That's surprising, especially because those foods are often seen as gentle.
Yes, and individually they may be fine, but together, especially on an empty stomach, they soften the enamel and feed harmful bacteria. And once that process begins, even healthy routines later in the day can't fully undo it.
So it's not just what we eat, it's when and how we eat it.
Exactly, and in Japan, we teach our patients to start the day with warm water and fermented vegetables or miso soup, not citrus or starch. These foods balance the mouth's environment and prepare the digestive system gently. They also introduce beneficial bacteria right away, which helps control the oral microbiome before the first brushing. When seniors make this shift, we often see improvements not just in teeth and gums, but also in bloating, energy, and even focus. That's because the inflammation triggered in the mouth doesn't stay in the mouth, it travels. And when the body is flooded with tiny constant stress signals from the gums, it impacts memory, mood, and immunity. So breakfast isn't just a fuel decision, it's a microbiological one.
That really widens the scope of this. We're not just protecting teeth, we're protecting the whole system from daily inflammation. And I imagine that's even more important for seniors who are already managing chronic conditions.
It's essential because when the immune system is already working hard, any added stress, even from a misguided breakfast, can tip the balance toward disease. That's why oral health must be seen as part of whole body care, not cosmetic hygiene.
It's humbling, honestly. We spend so much money on whitening strips and toothpastes, but barely think about our breakfast routine.
And yet that routine is the most powerful starting point for oral strength. It sets the tone for pH balance, microbial harmony, and nutrient absorption. If you begin the day acidic, your body spends the rest of the day compensating.
That makes me wonder how many well-meaning habits, low-fat yogurts, granola, even lemon water, are silently wearing down enamel in older adults.
Many of them are, especially when paired with stress or dehydration. That's why listening to the body becomes more important with age, and adjusting the morning meal can sometimes have a bigger impact than any product on the shelf.
That ties everything together, because what I'm hearing is that stains, plaque, and gum disease aren't isolated problems. They're reflections of deeper imbalances in circulation, immunity, digestion, and routine. And when we fix the environment, both inside and outside the mouth, healing begins naturally. So let's take this even deeper. Why do you say stains aren't just cosmetic flaws, but actual warning signs of imbalance?
Because stains are not just discoloration. They're messages. They tell us about acidity, about nutrient deficiencies, and even about digestive stress. For example, yellowing at the gum line often points to bile imbalance or poor fat absorption. Grayish stains may signal chronic dehydration or medication residue. And when those stains deepen over time, it's not just a cosmetic issue. It's a clue the body is struggling to buffer its internal environment.
That reframing is so important. Most people look in the mirror and feel shame, like stained teeth mean they're dirty or lazy. But what you're saying is that it's more like looking at a diagnostic chart. The mouth is speaking, and we just haven't been taught to listen.
Exactly. And when we try to scrub away the signal with bleaches or harsh treatments, we're often damaging the very tissue that's trying to communicate. True oral care is not about whitening, it's about understanding. Stains fade when the body finds balance again, when digestion improves, when minerals stabilize, when the mouth is nourished instead of attacked. That's why in Japan, we prioritize gentle cleaning, pH balancing foods, and daily rituals that calm the system, not stress it. And the result is not just brighter smiles, it's better aging.
That puts so much in perspective. We don't need harsher routines. We need wiser ones.
Yes, and those don't have to be complicated. They just have to be consistent.
So maybe that's where we end today. Not on a product, but on a mindset. That the mouth isn't separate from the rest of us. That when seniors care for it gently, from the inside out, they're caring for their entire future. And that a healthy smile isn't the goal. It's the sign you're already doing something right.